Hi friends, hope you guys doing good and I'm pretty sure you must have done very well in your NEET PG 2023 exam. So the feeling of anxiety post exam is very normal. All I would suggest you guys is to take a small break, keep yourself relaxed and calm and wait for the results, and we shall definitely enjoy the results together. So as for the general surgery, the various questions during the round, whether it was easy, whether it was tough, well, my friends, let me tell you one thing. The simple formula to crack your any NEET PG exam is revision. And as for the general surgery sake, the question that we'll be discussing in this recall series, so far I have around 10 to 12 questions from you guys. So these questions are going to basically tell you whether your general surgery was tough or easy. So let's begin our discussion. So the first component was first question was regarding your QSOFA components. So this question was a straightforward repeat from your FMG exam conducted by the NB, and we had shared this question in our FMG January 2023 recall session, where we had also specified for the NEET PG aspirants that you might get a question from the FMG session. So the components of your QSOFA were your respiratory rate, systolic blood pressure, and your altered mental status. So as per the information gathered from the students, you had a combination of options with respect to this parameter. So the correct option would have been with your respiratory rate, systolic blood pressure, and your altered mental status. Right, so this was a very straightforward question from your general surgery. Then we had this varicose vein with eczema, your CEP classification. So friends, we had discussed varicose vein in our FMG session. Then we had discussed the varicose vein in our NEET PG revision session that we had conducted, and we had also specified to you guys that how important is your varicose vein CEP classification and that you can expect. So the correct answer for this varicose vein with eczema would have been your 4A. Not only this, before your NEET exam, we had this high yield general surgery topics 2023, where we had discussed regarding your CEP classification, right, where your C2 was your varicose vein, C1 being your telangiectasia and your reticular vein, C3 varicose vein with edema, C4A was your pigmentation eczema, 4B was lipodermatosclerosis, atrophic Blanche, 4C corona philbectasia, C5 was your healed venous ulcer, and your C6 was your active venous ulcer. So again, you can see a straightforward question. All you needed was you to revise. Then your next question was regarding your treatment of penile CA. So the options and the images that we could gather were this: penectomy, topical 5-fluorouracil, CO2 laser, and podophiling. So we had discussed this in our class note. Those that attended my class had shared with me. So the treatment in penile carcinoma are into two groups. First is regarding your primary tumor and second is regarding your inguinal nodes. So in case of primary tumor, when you have your advanced cases, you need your total penectomy with perineal urethrostomy, and in case of your inguinal nodes, you delay the treatment by 3 weeks after local treatment of your primary lesion, and the antibiotic treatment to see if because it would subside if it is an infective cause. But over here in the question, as the candidates told me, the lymph nodes were negative. So please do confirm for the same. However, the answer over here would have been your penectomy. There was no confusion regarding this. But if your lymph nodes would have been positive, then your treatment would have been changed, because over there you would have to go for a USG guided fine needle aspiration cytology followed by your block dissection. Right. Now moving on to the next question. A 45-year-old female presented with your acute chest pain radiating to back and interscapular area, difference in both arm blood pressure. What is the diagnosis? Right, so the answer over here would have been your aortic dissection. So if you look at the revision class that we had conducted for your NEET PG, we had this some specified characteristics of your aortic dissection discussed, which was your tearing interscapular pain, and your widened mediastinum, which was also given in your question clinical scenario. So this were the answer would have been on the basis of your question aortic dissection. I forgot to mention over here the chest x-ray mentioned your widened mediastinum. So this classical features were depicting towards your aortic dissection. Again, we had anticipated this question because you can see in our test and discussion which we had conducted, we had this almost similar question framed over here with almost similar options, right? So again, you can see the emphasis of revising the important topics and to the point topics. Then again, the image, what is the diagnosis? I am not sure about the options that was given, but as you guys shared with me, the answer was straightforward, a putty kidney, as you can see a cemented kidney over here. So again, this question we had discussed in details in our NEET high yield topics 2023 exams, right? So you can see this was asked even in your NEET 2022 and X-ray was asked in 2021. So it was again a repeat of your previous question. So the answer over here would have been putty kidney, which is seen in your renal tuberculosis, right? So now detailed discussion regarding your renal tuberculosis is mentioned in this video. However, we will not be discussing a lot of detailed explanations in this video, rather focusing on the correct answer and the approach that we could have got for this correct answer. So far what I can form from my opinion is the guys who stuck to the basics and revised would have found the paper easy. As such, the level of the paper might have been difficult, but trust me guys, you don't need to be specialist of 19 subjects. You need to be specialist of the MCQs of the 19 subjects, and all you had to do was a good revision. Now moving on to the next question, we have a 25-year-old casualty of RTA has no eye opening, says inappropriate word, localizes to pain on right side and extension to pain on the left side. Calculate your GCS. So GCS is a favorite topic of your examiner and is invariably asked, which we have practiced a lot many times. So if you look at the particular point, no eye opening. So eye opening, no. So what score would you give? Is your 1. It was an E1. Then says inappropriate words. So again, if you look at the verbal response, inappropriate words, you have a score of 3. You have a score of 3. And then you have localizes to pain on right side and extension to pain on left side. So please candidates, remember this, you take the best motor response, right? So the best motor response over here would have been localizes the pain. Now localizing pain is your M5. So if you calculate over here, it would have been your E1, V3, M5. That makes it 9. Pretty sure you guys must have got this correct. This was a straightforward question asking your GCS. Now the next was an image based question. So this was the image that you guys have shared with us, and it was also discussed in our FMG revision class, and not only in FMG revision class, we also discussed it specifically for you guys in the NEET PG revision class also. So if you look over here, you have a SDH. So this, the diagnosis was an SDH. Now if you look at this, again this was discussed, and EDH would have a biconvex shape, whereas your SDH would have a concavo-convex shape, right? So this was absolutely a straightforward image based question which we have discussed and revised multiple times before your exam, right? And regarding the important points, you guys can again check out the video which is on our YouTube channel for further knowing of the extra points. Now the next question that we have was on Fournier's gangrene. So the question that many people says was regarding this, the same repeat which was asked in your NEET 2021. That is, it is a mixed flora and aerobic and your anaerobic. Right, and some say that it was an image based question. So again, we had discussed this in our high yield series just before our exam, right, where it was, we had specified the importance of this topic, that is being repeated in NEET 2021 as well as NEET 2022. So the answers, the options that people told regarding your Fournier's gangrene was asking regarding your, which is the correct statement. So one of them had mentioned it being a polymicrobial infection. So if that was in your option, then this would have been the answer, and your image would have been classically this. Now some people have mentioned that there was another question asked with respect to your Fournier's gangrene, then when it extends to the abdomen. So that is your Milanese gangrene. We might have not mentioned this in our last video series, but then we had definitely mentioned that it progresses from the genitalia perineum to the abdomen. So the exact question is still yet not known to us, so please do share your exact question. But as people told, the Fournier's gangrene, the variant which was occurring in your abdomen, so that is your Milanese gangrene. And another important point that you guys need to remember, which was actually asked in your FMG exam, is that your testes is usually spared in Fournier's gangrene because of its dual blood supply. Now the next question that we have was asked from the pancreas. So a patient of your chronic pancreatitis presents to you with CT report stating dilated MPD more than 1 centimeter. So what would be your treatment? Medical, Whipple's or Pustav? So we need more details for the question, but then as we discussed in our class, the surgical treatment flowchart, if it is a dilated pancreatic duct, we have the options of an endoscopic. The endoscopic treatment would include a sphincterotomy, lithotripsy, stone extraction, or a stricture dilation or a stenting, whereas the surgical therapy would include your phrase or a modified Pustav's procedure. Now, since we do not have much in detail, considering this amount of information that we have got, chronic pancreatitis, dilated MPD, the answer over here would have been your Pustav's procedure. So again, this was a straightforward question coming from our notes, where we had not discussed a lot but specific points and planned our surgical treatment according to the questions that could be framed. Now the next question that we have, the next few questions that we have are from your breast cancer. So the first is your best prognosis of your breast cancer. So over here the answer was your ER positive. Again, if you look at this screenshot from our class note, we had discussed this table from the Bailey and Love, where we had also specified that how important the breast is this time for your NEET exam, considering the fact that your 20th edition Bailey and Love has the new entire chapter of breast written by the faculties of the AIMS Delhi. So your prognosis includes your size of tumor, stage of disease, axillary lymph node involvement, grade of tumor, HER2 positive, triple negative, presence of lymphovascular invasion, extensive DCI component, and your high 67 index, where your patient factors would include your younger age, premenopausal woman, BRCA associated tumor, family history of breast cancer, prior history of breast cancer, obesity, and your failure to complete your intended treatment. Now the next question was regarding your BIRATS. So some say it to be BIRATS 4, some say it to be BIRATS 5. So I'm not pretty sure what was asked, but what I'm sure is that you guys must have done it definitely correct, because again this was a straightforward question, again which we had discussed just before our exams in our YouTube also. So the BIRATS assessment is your category 0 being assessment incomplete, category 1 being negative, category 2 being benign, category 3 being probably benign finding. So most of the candidates told me it is category 5, so it is definitely highly suggestive of malignancy, whereas if it was 4, it was suspicious of abnormality, and 6 is known biopsy proven malignancy. Now those who want further explanation can go and watch out this video, where we had again explained this particular concept of your BIRATS and also specified how important it for your exam. Now there was another question regarding your breast carcinoma, which people have yet not confirmed, but it was regarding your neoadjuvant chemotherapy. So please do let me know what was exactly the question. So in this session, we end our discussion over here with around this 10 question. So as I told you, as we progress and we find out how tough was the surgery paper, so discussing this 10 questions, what I can say is the candidates, those who had revised, must have definitely made this 10 questions correct, right? So paper might have been difficult, but for those who have revised, it would have been easy. So sticking to your notes and revising is actually the key to success. Now those who want for further explanation can check out this YouTube videos in my YouTube channel, or they can also look for them in your Game PG app, NEET PG channel, right? So this was the first session of recall. Now I would request all of you to definitely put down the further questions that they have asked. The few questions that we have asked that I have come to know is regarding your hernia. We have around 2 to 3 questions. Then we have one question on neoadjuvant chemotherapy of the breast, right? So similarly, do let us know for the other questions, and we'll be coming up with the revision recall series 2 for the same. And if there are any other corrections in these questions and all, you can definitely drop in a message at the comment section of your video, or you may email them to me at my this email ID, right? So I hope this recall session was useful for you guys. Do not take tension. Everybody panics at this stage, and it's not humanly impossible actually to recall all the options exactly. But if you know that what you have recalled is actually correct and you have marked it correct, then trust yourself, believe yourself, because we know you have done it correct, right? So do not panic. If you have any doubts, any problem, you can connect me on my email ID and I shall definitely get back to you. So take care until I come with the recall series 2 and the further modifications of the options or the questions, if any, from this video. So thank you, take care guys, and warm greetings of Happy Holi in advance.